Hello, I'm Dr. Robert Arnone, and I practice in St. Louis, Missouri. I am an upper cervical specific doctor of chiropractic. Sounds like a lot. It's coined a brainstem specialist, and the reason is pretty simple, really. This here is a model of the base of the skull and the top two bones in the neck. The top bone is called Atlas, if you know, like in Greek mythology. Atlas holds up the globe, holds up your world. Well, your Atlas holds up your world, your skull. Okay, and then here we have what's called C2, or axis. So the skull and the Atlas will rotate around that axis. And so what's so important about C1 and C2, Atlas and axis, is that they surround and protect the brainstem. You see, in this hole here, we do have a hole in the base of our skull, is where the brainstem will sit. See, up in the brain, or up in the skull here, is the brain, but down through that hole goes the brainstem. And just like my finger is doing here, it goes down into C2, in some cases as far as C3, but in most cases C2, and then up to about here into the skull. So we've got about the 2 inches or so, 3 inches, when we get down to it. And that's the medulla oblongata. Now, the importance of this is it can't be overstated. You see, nothing trumps the brainstem. The brainstem runs and controls all function in your body, either directly or indirectly. People have been shot in the brain and lived. Not doing too well, mind you, but lived. People have had car accidents where the cord has been severed at different levels. Again, not doing great, but can live through that. You're not going to meet somebody who was shot in the brainstem, stabbed in the brainstem, and live. Instant death. Because that's the area that runs everything in the body. And if that gets injured to that degree, the body cannot overcome. Now, we have advanced training here at this office, Arnone Specific Chiropractic, again here in St. Louis, where I'm an upper cervical practitioner, and what that means is babies, children, adults, athletes, you name the walk of life. We will examine and look to see if there is what's known as upper cervical subluxation, where these bones can be in the wrong direction, and what happens is they start to make pressure on that hole. See that opening in there? What will happen is the bone shifts to the side and it affects the brainstem that's sitting in there. Many different things can come out of this. We can have people who have things known as fibromyalgia, migraine headaches, depression, people with cancer of different parts of the body. Lately we've had a bunch of people with trigeminal neuralgia, who, we get that pressure off the brainstem and they're doing better. Neurologists don't necessarily agree with it or can't explain it, but that's really not that important to us. See, because if we could find the problem and correct it and help that person improve, then that's what we're here for. You see, 9 of the 12 cranial nerves actually originate in the brainstem. So they're the cranial nerves are the nerves that will supply up into the head, like eyes and nose and ears and such. And so, if they're originating off the brainstem, we get pressure off the brainstem. Does it make sense that we can possibly help that improve? Well, we know it does because we've seen it time and time again. We do not do any forceful twisting of the head or neck. Actually, it's more of a specific hand-only adjustment at either C1 or C2, according to what we measure and analyze, show you, explain first, and then we would proceed with correcting the interference so you actually can improve and get better. So that's basically real simple, upper cervical. More adjustments are not better whatsoever. Actually, less is more, especially when you're dealing with the brainstem area, the upper cervical area. There needs to be a respect for that, and that needs to be monitored. So patients will come in to get checked at our office. They do not come in to get adjusted. Big difference. Okay? And I think that's one of the big reasons why we get such phenomenal results at our office. Almost every single case gets completely well and off medications. At the worst scenario is they're taking less meds and they're getting some better. So something right is going on here, and it's basically following in the teachings of Dr. B.J. Palmer, reading that philosophy, really diving into that philosophy, and realizing that the innate intelligence in the body, the intelligence of your body, it's running your body right now, knows more about you and how to get you well than I or any doctors would ever know. And I think that's one of the first steps is kind of realizing that, putting innate way up here and putting educated down here. Okay? The problem is we see that a lot with chiropractors, osteopaths, certainly medical doctors. They kind of flip that around, or they try to. They think they're the one who's so great, they're on the pedestal, and the innate intelligence doesn't really know that much. When you operate in that opposite ratio, well, to the degree that you go opposite is the degree that you will not get well. When you operate in that ratio where innate is high and educated man is low, so the doctor, like myself, knowing that your innate intelligence knows more about you than I would ever know, the more we realize that and let that run everything, to that degree, that's how quick and how efficient and how true and how complete you get well. So that's what it's all about. GetWellSTL.com. I will get back with you soon. Take care.